the introduction, Courtney. Good morning, everyone, or good afternoon. Does anyone, actually, everyone hear me okay? Because we have a microphone, I just want to know actually if I will need one. So I'm happy to see that we have a good turnaround today. That's pretty exciting. I hope you didn't come just for the lunch. I was expecting actually to only have women and young ladies, but we have some young men interested in menstrual health and hygiene. So I will actually just pick up 2 or 3 randomly and then ask them why you came here and then what you expect from this seminar. Starting from you.
Oh, wow. Well, we're taking global health challenges now, and one thing that we talked about was maternal health and how big of a global disparity is. So I just wanted to elaborate a bit.
Okay, sounds good. And what about you?
I actually was invited, so I decided to come just to see what the talk would be about. I like to learn about different aspects of public health.
Okay.
So.
And what about you?
Lunch.
That's what I thought, yeah, it makes sense.
Well, clearly, this is a very important topic, and usually, traditionally, we see the global health more from like infectious diseases, non-communicable diseases, but really, we just look at those problems from this perspective. So I think it is quite worthwhile to listen.
Indeed. Yes, so before actually I start, I will give you a little bit background of who I am and why I came here and what I'm doing, even though Corley did a very good introduction of myself. I was born in Rwanda. I have a dual citizenship, French and Rwandese. I grew up in 6 different countries, speak as many languages, and I came here because of the challenge. I was working comfortably in Paris for the French electrical utility. And then I received a call from a professor here at Duke University, Jeff Glass, who talked to me about this project with the Gates Foundation. That's very challenging, and I could relate to that because I lived also in Africa and I could see that firsthand. So when I came here, I was not expecting this to be that hard, to be honest. I thought it would be a 2-3 year job program and then it will be done and then everything will be solved. But it's more complex than that. Solving menstrual hygiene or solving sanitation is not just an engineering problem. It's more complex. It brings economics, it brings financials, it brings social sciences, it brings anthropology, it brings everything that you can imagine. And that's actually what excites me about this job. So today, I will share with you an overview of what we have done so far with respect to menstrual hygiene and health. First, I will start with an overview of the Center for Watershed, for those who are not familiar with the Center for Water, Sanitation and Hygiene that we have started a couple of years ago here at Duke University. And after that, we will discuss a little bit about I will give you some figures, discuss about menstrual hygiene, menstrual health, what it is about, how can we actually implement such programmings and why it's so important. And the next actually topic would be, what do we do with menstrual waste? This is a very important topic because unfortunately in most WASH programmings, menstrual products disposal is not part of the intervention. And because there is a problem and because there is a challenge, there is always an opportunity. So we came up with a way to address this challenge with a technology called S.H.E, that stands for Safe Hygiene for Everyone. And I will give you some technical information about this technology and how it works, what is the environmental impact, and how we can implement this technology in developing worlds, but also in other places. And the last point of this seminar, this talk, would be to give you my thoughts on how we can take a technology from R&D to the market, which is very hard. It's a long path, but it's worth trying, and you will see it's also exciting. Yeah. So the Center for Watershed. So we have one principal mission. Is to develop new technology-based health solutions. And I want to insist on the fact that our goal is to bring these solutions to resource-constrained environments around the world. And when I say resource-constrained environments, I'm not only talking about the developing world. We can also envision that these solutions are needed here in the United States. I was traveling to Alabama, and I could see that some people are still in need of sanitation solutions. You can imagine that space applications can need actually such solutions. So when we talk about resource-constrained environment, we think about where we don't have access to water, where electricity is very hard to get. So we have three main focus areas. The first one is the water and sanitation with the reinvented toilets. So in 2011, the Bill and Melinda Gates Foundation started this challenge called the Reinvented Toilet Challenge, because for those who are not aware of that, the toilet, as we see it, as we have it right now, hasn't been changed for centuries. So the design is the same, and it doesn't really fit with the way we see actually the future from an environmental standpoint. So we started this challenge, as I said, 7 years ago, where the goal was to develop a new decentralized waste treatment system. The second area of focus is hygiene, and that will be actually the main component of this talk. And the last one is what we call smart toilets. As you can imagine, in feces, in fecal matter, you have a lot of information about yourself, about your diet, about who you are, about all the diseases that you can have. And our goal is basically to develop a system that can retrieve this information directly from your feces. So for you, the end user, basically nothing changes. You use the toilet as every day, but there is a way that we are trying to develop in order to collect this information, basically to give you a feedback on your well-being. So most of our funding come from the Bill and Melinda Gates Foundation, but also from the US Department of Defense, and I will give you later on an example of the applications that the US Department of Defense is interested in. Yeah, so the reinvented toilet. As I said, the goal was to have a decentralized off-grid toilet that can only rely on the fecal inputs. So the way the toilet system worked, at least the design that we had at the beginning, was that we would use the feces and the urine as the fuel for the system. So we would separate the feces and the urine, dry the feces, burn the feces, and then use these heats to power the system and disinfect the urine. And then once the urine is disinfected, we can use the water that we extract to flush the system. That was the idea at the beginning. Now, what we have realized is that if we want to have such system for, let's say, households, it may not work because of the energy balance. Basically, this is a good concept if you want to have a toilet that can serve, let's say, 100 or 1,000 people. But for a single household, then we had a problem with the energy balance. But it's still feasible, and we came up actually with a couple of other technologies based on this initial idea. The second way we work with the Gates Foundation is that we decided for WASH to oversee what we call the Sanitation Technology Cluster. So we are not the only grantees from the Gates Foundation that work on the reinvented toilet, but you have groups from all around the United States, all around the world, I would say. And the purpose of this Sanitation Technology Cluster basically is to identify technology gaps. Once we identify technology gaps, instead of, let's say, hiring new people to work on this specific topic or even to develop new capacity, we prefer to rely on external partnerships, to rely on people who are already experts in this specific area that we want basically to fill the gap, basically just to progress much faster. And then once we fill the gap, then this information can help the rest of the portfolio. Yes, what I'm showing you here, it's basically a trailer, and inside this trailer you have a toilet. It was a prototype for the Department of Defense, because for those who don't know, in war zones, most casualties occur on the supply line. And the Department of Defense came to see us and then asked us basically to develop a way to sanitize and then to recover energy from waste. And this way they will spend less money and they will have less casualty from going and getting water supplies or even energy supply. So that was actually very interesting, and I was very lucky actually to be part of this team. Now, the smart toilet. As I said, we are developing this diagnostic tool in order to get information about your well-being, but directly from your feces. Because unfortunately, currently, when you are sick, let's say in some countries where people have some worms, some helminths. Let's say young kids play outside, they have worms. What they do, they have to go see a doctor, and then they need to take a sample, collect the sample manually, and then analyze that. So what we are trying to do actually is to avoid all of this, just to directly collect the information inside the toilet bowl. And for those who are more interested in this program, we are currently working with the BAS connection to better understand the limitations and also the feasibility of these concepts. Our philosophy is quite actually simple. So we like working with people. We don't have such an ego to believe that we can solve all the problems by ourselves. So here actually it's just a sample of all the groups, all the companies, the universities we are currently working with. And what is more important, I want to say, is that we work on a continuum, meaning that we go from R&D. So we have a basic concept, we do some lab research, we develop the idea, we demonstrate the idea at a lab scale, but then we also want to prototype this new solution, this technology. Once we have prototyped the solution, then we go to the next step, which is piloting. So we want to pilot these technologies, these ideas, in a less ideal environment. So that's why we go to India, we go to South Africa, and then we see actually firsthand what's really happening. An example actually, we had actually this toilet that I showed you previously. It was working fine here in North Carolina, and then we started doing some testing in India. And what I'm telling you is that for you, the end user, the toilet is very simple, but under the system you have basically a belt that will separate the solid and the liquid. And this belt normally is resistive to any type of materials. So it was working very well when we were here in North Carolina. So we shipped it to India. We started doing the experiments, and every 2 days it was broken down. We couldn't understand because normally it was working here fine. But then what we realized is that culturally, what they do when they want to clean the toilets, they use bleach, highly concentrated bleach. And then this bleach basically was causing the system to fail every 2 days. And this is something that we learned from going out there, because we don't want to change people's behavior. Because to think that, okay, we will develop a technology, an optimal technology, and then just bring it to some people and then say, okay, this is the right technology, we know it better because we live in the United States, now you need to adopt it. This is wrong. When you start developing your technology or your solution, it can, I don't want actually to emphasize technology, but just a solution, you need to go out there and then discuss with people and then see actually if people want your solution, if people can adopt your solution, and also it's an iterative process where you get information from the end user that will allow you to improve your solution. And the last part of this continuum is commercialization. Because yes, we have a solution, but do we want to keep the solution for ourselves? Do we want to keep this technology for ourselves? No, we want at some point people to benefit from that. And this is very important because you want the commercial partners to be involved as early as possible in your development stage. And this is something that I will talk again at the end of this presentation. Yes, now let's talk about menstrual health and hygiene. Actually, can someone explain to me what is menstrual health and hygiene? No one knows? Wow, this is the global health institute. Yes, please.
Okay, so it's how a woman controls and basically deals with her menstrual period, both and including like sanitation and capturing the waste, disposing of that, and then also her own health and well-being, preventing infections, et cetera.
That's perfect. So the talk is over. Thank you. Yeah, so this is actually that a comprehensive menstrual hygiene and health program has to include everything that she said. So first of all, people need to be trained about menstrual health and hygiene. So we need to know what it is. So we need to educate people about menstruation, because unfortunately, in some regions, it's still a taboo to talk about menstruation. And some young girls are facing bullies when they have the period, which is insane, and for somehow actually it's still happening in most countries as we are talking right now. So this is very important actually to educate girls, but also to educate boys about that, to educate parents, so no one actually feels ashamed to discuss about that. Another point is to have access to a place where you can change your absorbents in complete discretion. So we need to build facilities for girls to go. So having toilets, this is one thing, but if these toilets are not gender friendly, then you don't basically provide the comprehensive approach to menstrual health and hygiene. So yes, this is what I was mentioning with having washrooms and also having access to water and soap so you can clean your hand and clean yourself after changing your menstrual pads. Another point that is important is to have access to menstrual pads and to have access actually not only to menstrual pads but to any products that you can use for absorbing your menstrual flow. And what I want to say is that in most programmings, you will have always a focus on providing pads, providing absorbents, providing such solutions. But then what happens when you have used products? What do? Do you just toss them in the water or place them in your school bags? And that's actually the biggest challenge that we have right now, is how we can safely dispose of used menstrual absorption products. And this is the challenge that we are trying right now to address. Now, why is it so important? The first answer is, around the world we have, I think, almost 2 billion young girls and women who are at the menstruation age. So it's almost 1/3 of the population. So we cannot just close our eyes and then say, okay, they are not important, because these people can be our daughters, our sisters, our parents. So this is very important to keep that in mind. And because we all know that when you have access to a complete and comprehensive MHH, basically you gain in confidence, and we have seen that. We have seen that, some girls are not going to school when they have the menstruation. In Rwanda, actually, there was a survey showing that 20% of the girls reported missing 30 days at school every year. Now you will say, okay, 3 days, what is 3 days? Just 3 days, it's 3 days of vacation. Everyone wants to have some vacation, but actually that's not good for the economy, that's not good for the society. Because if you think that half of the human population is composed of women, and they are all missing schools, then you are losing in productivity at some point, and at some extent. So this is very important actually to address this, because it's a problem that faces 50% of young girls at school age. Sorry. Now, this is actually a very interesting, I would say, data that that was published a few years ago. So for every 10% increase in female literacy, you increase your GDP, your gross development product, which is great. Meaning that if you invest if you keep girls at school, then ultimately you will increase the productivity of your country. So that's why this should be basically one of the priorities of government but unfortunately it's still not the case. Now, what are the current disposal options? So can someone actually tell me what you think of disposal options we have in most countries? Just a guess.
Burning.
Yes, burning. What else?
Landfill?
Yes, landfill.
Septic systems.
Yes, some people just flush away.
Yes, septic tanks. Yes, flush away. What else?
Reusing products.
Unfortunately, yes. Some people will wash the menstrual pad and then reuse them even if it's not healthy. But that's not actually the disposal option. Yeah, actually that's pretty that. And all these options basically are not necessarily good for the reason that we will see together. First of all, when you discard your waste within dustbin, you will say, okay, that's great. I have a place where I can just dispose of my menstrual pads, just like this bin. And then what happens next? What will happen is that all this waste will end up in landfills. And menstrual pads take more than 500 years to decompose. Do you know how many, what is the volume of menstrual waste that is produced by women every year? Okay, just a guess. 50 liters of waste every year by every woman, which is a lot. So if you multiply by 2 billion, then you can imagine what is the volume of waste that we have actually here on Earth. Yeah. So another disposal option that we have seen actually is throwing away in the open. And what happens is that all this menstrual waste will end up in land, in water sources, and then there is contamination. And then, of course, if water is contaminated, then the person who will use this water for cooking or for just drinking will also be, become sick. Burying, this is something that we see very often. Unfortunately, when you bury your products, then it's very easy to reach for that. So some kids, they are just playing and then they will dig and then they will find them, or even some dogs, some pets around the house. Dumping in toilets and latrines, which is terrible because it causes all this sanitation system to fail. And then the last thing, yes, is burning in the open, which is definitely not good because of all the bad emissions. Now, we have seen in some countries, especially in India, where they are using more and more incinerators. But the thing about incineration is that it has to be very well controlled. Because if the temperature is not appropriate, then you will generate some carbon monoxide, you will generate some dioxides, you may generate also some NOx. So this is perhaps one of the best options, but it has to be very well controlled. And this is what it's about. The S.H.E technology, basically, it's an incinerator, but it's an incinerator that has been developed to provide discretion, to provide safety, to also be affordable, which is the most important thing. So this picture actually is the prototype or the concept that was rendered when we started the project, and that was here the first prototype that we had in lab. It was relatively big, so we did some re-engineering to shrink the size, and this is what you have here. This is the new rendering, as you can see. But this is just one user case where the incinerator is placed in a toilet, in a bathroom, I would say, and easily accessible, and with the exhaust that is here. Let's now go a little bit in details. For us, the most important is the user experience. So you don't want something too complicated, otherwise no one will use it. So with this system, actually, the user has only one interface. It's a button. So when you press the button, then it's activated. So the way it works is that we have a pad chute here. So you open your door, And then I will actually use the pointer here. So you open your door. And the system will count how many pads are inserted. So you open the door, and then the pad will be dropped here. And then here we have we have a basket. And then the basket will start collecting all these pads. And above the basket, you have a burner that is supplied with LPG, liquid petroleum gas. It's methane, it's affordable fuel. And then what happens is that once we have reached an optimal number of pads, in this case it's between 10 and 15, then the system will be locked. So the user cannot anymore open the incinerator, and then it will start incinerating for 15 minutes, and then at the end what you have is just ashes. So you have almost 90% of volume reduction. So I was talking about 50 liters of menstrual waste produced every year. Now we go from 50 liters to less than 5 liters. And the good thing is the ashes that we produce with this incinerator are pathogen free. And they can be reused for soil amendment because it's basically carbon and eventually some traces of metals in a very low concentration that you can just use for soil amendment. Now, once actually you have a technology, a solution, you want to test your solution, which is critical for us because before we bring the technology out there, we want to be sure that it's safe for everyone. So we need to come up with a testing protocol. The first thing that we do is, okay, we have to go on site, we have to talk to people and then see how they use menstrual pads, because we cannot say, okay, we will design an incinerator that can accommodate, let's say, 1,000 pads, if it will never happen actually on the field. So we need to know exactly how many pads are used per week, what is the weight of these pads, what is the moisture content, and what is the quality, what is the fabric that they use, and all this information. So we collect this information, and then based on this information, we will design a testing procedure, and then we will compare our technology with competitors. Because at the end of the day, you want to commercialize your technology. And I know it sounds very businessy or very greedy, but if you want anything to be sustainable, at some point someone has to pay for that, and you cannot give everything for free. Unfortunately, it doesn't work like this. So what we have done for this program, so we went to India. In India, we have local partners. We have a local team that belongs to the STEP program. It's the Sanitation Technology Platform. It was created by the Gates Foundation to support the grantees field test their technologies. So it's a very good team. They have a background in engineering, in lab sciences, and they are very helpful to us. So we decided to work with a cotton mill where we have 20 young women working there. So it was actually for us a very good environment to collect data on menstrual hygiene and health. So what we have collected as data is, first of all, how many pads are generated per day, the average weight, the moisture content, and you can see that here the moisture content goes from 17 to 84. It's because, and this is something that we didn't know before we actually go there, is that in some cultures, women will wash their pads after using them, because they don't want anyone to be in contact with their blood, so they will wash them, so it increases the moisture content, and it's even harder basically to burn when you have too much water. So this is a very important information to us because it helps us not only design our testing procedure, but also design our incinerator to be, let's say, optimal. Yeah, so we collect actually all this information, and then we come up with this procedure where we will take 5 pads with a certain moisture content, 4 with another one, another level of moisture, and then 1 cloth pad, because we have realized that some women will come with the house-made cloth pads. So we compared our technology with the competitors, and again, what is funny is that depending on how you fold your pads, you have different emissions. What you see here is the particulate emission as a function of the way we fold our pads. So this is also a very important way of designing our testing protocol. Unfortunately, we cannot ask people to come and then neatly fold the pad before. No, this it never happens like this. So we will have a mix, and we need to accommodate for that. At the beginning, I was saying that all these technologies are for resource-constrained environments, so we need to think about the energy consumption because it's something expensive in some areas. So we did some calculation, and then we realized that our system requires less than 30 watt-hour of electricity. Perhaps for you it doesn't mean anything, but it's basically less than a radio clock in terms of electricity. Now, this is the system that we have needs electricity to run all the automation, but also needs gas to co-fire the incineration. So we need a gas supply, and then basically what we found out is that you could, if I'm not wrong, you could incinerate 200 pads a day, and your system, actually your gas tank, would last more than a year. Which is very interesting and encouraging because in some areas, having access to gas, even though it's relatively affordable, it's not easy for everyone actually to have access to such fuel. So that was actually some information about the technology. Now, what I like the most is the pathway to market. We need to answer actually a few questions about if you want actually to bring something to the market. So you need to understand who are your competitors. You need to understand the use cases, because you can imagine that the incinerator would be placed here in a room or outside. So you need to know all of that in order to better shape your technology. You need to define, okay, is there actually a market? Because if there is no market, then there is no need actually to spend your time going out there and then trying to sell something. Who are the early adopters? What we call early adopters are people who are willing to pay the high price. Just like with the mobile phones, when let's say the iPhone X was out there, the first people were paying, I don't know, I would say $1,000. But then if you wait a year or wait 2 years, then you will just pay half the price. So you need to find actually who are these people willing to pay a lot for something that will decrease in terms of price over time. And can we be cost competitive? Because ideally you want your systems to be everywhere around the world, especially in the poorest countries, so you need to come up with something that is inexpensive. So we asked actually some folks from RTI to do some, to compare or to do a landscape of the technologies that we have in India. I don't know actually if you can see very well, but bottom line, what we get from this analysis is that the market actually doesn't exist. Even though some companies have sold a few thousand units, compared to the size of the country, it's basically nothing. This is good to know that, okay, some people are willing to pay for some incinerators, but there is still actually many things to be done. And one of the key challenges is to have enforcement, because right now we are competing against free. And this is hard, because how will you motivate someone to put a pad in an incinerator if that person can just toss it out there? So yeah, so this is again something that we want to better understand how to, I want to say manipulate people's mind, but just understand how they work, other things. So here, this shows you how we compare our technology with the Indian markets. So in terms of capacity, so we have an incinerator that can basically incinerate 10 to 15 pads, which is the average that we have found on the Indian markets. Now it takes 15 to 20 minutes to incinerate. We can still do better, but then again, this depends on the use case, and we will see that on the next slides. The costs, I think, we are at the moment, our prototype costs more than $1,000. We can still actually work on that to get under $400. The expansion, what I call expansion, is can we incinerate other wastes, because I was actually traveling to South Africa, to Rwanda, and the first thing people were telling me is that, okay, can you incinerate medical waste? Which is actually what is needed right now, because this is where you have money. Even though in terms of markets, menstrual hygiene may be a larger market, but because right now people are only focused on clinics and health centers, this is where you want to go first if you want to enter your markets. In terms of footprints, emissions, monitoring, this is something where we are doing very well. We can still improve, but I think our focus area will be here. And I said the time and the expansion depends on the use case. Because yes, you have different use cases. As I said, you can imagine that your incinerator will be in a bathroom. Your incinerator can eventually be outside the bathroom, and then an operator will come and then collect all the pads and then go incinerate the pads. So in that case, you don't necessarily need an incinerator that operates within 15 minutes. If you have to collect a larger number, if you place your incinerators, let's say on campus, you may need a larger volume. So as I said at the beginning, it's very important to determine the use cases so you can adapt your technology. Now, in terms of the market size, again, a very important point, is there a market? What is the market size? Because when you go and then talk to an investor, the first question they ask you, okay, if I give you $500,000, how much will I get back? Because we are not talking about Gates Foundation who are giving some charity grants. We are talking about venture capitals who have only one thing in mind, even though they tell you the opposite. They just want to have a return on investment. This is as simple as that. So yes, there is a market actually in India, as you can see on the here on this right chart. So the Indian market, based on actually the study from STEP at RTI, the S.H.E market could sell 2 million units by 2030, which is encouraging to us, because I can take this slide, then go talk to some investors, and then they will be willing to put a dime on the development of this technology. Now, how do we estimate the cost of this technology over time? As I mentioned before, with the iPhone X, it becomes at a high price, but there is the economy of scale, and we hope that with the S.H.E unit, it will also be the same. So we are starting with $1,200 for one single unit. Now, if we produce more and more units, there is what we call the learning curve. So every time you produce, you double the number of units, you improve your rates by 10% or 15%, depending on the specialty parts and that you have in your system. So we have estimated that basically at a very conservative 10% improvement rate, if we can produce 500,000 units, then we can bring the cost down to $200, which is very, very, very competitive. And 500,000 units, you may think, okay, this is a lot, but actually this is not a lot, because as I'm showed here, the Indian market is 2 million units. And we are not only targeting the Indian market. You can think about Africa, you can think about some places in South America, and even here in the United States. Yeah, so now the last part is about crossing the innovation chasm. So Courtney was introducing the company that I started this year. What we don't want as technology providers is to end up with a technology that is just sitting there in the lab. So we want to cross what we call the innovation chasm. Some call that the valley of death. The reason why we call it the valley of death is because at the beginning, when you have a very exciting idea, you have the National Science Foundation, the NIH, all these foundations, they are excited, they want to understand actually how it works, to lower the risks, to do some basic research. So they will give you a few $100,000 just so they can understand what's going on, and then also to improve our understanding of fundamentals, which is great. But then what's happening? They will expect you to find some commercial partners who will take your technology and then commercialize. And then you say, hey, that's fantastic. I will take my technology, my results, and then I will go and then talk to the commercial partners. They will just laugh at you because they will say, hey, what you have done is great at the lab scale, but I want to make sure that, okay, I can manufacture this technology wherever I want to implement that. I want to make sure that there is a market. So they have many questions. And once actually you passed this value of death, then they are willing to give you a few millions. But now, who's going to take care of this part, of this value of death? Who's going to take the risk? And that's the purpose actually of Simbuka, the technology, the company that I created. Simbuka in Kinyarwanda means to jump. To jump because the concept is to jump over the value of death. And the reason actually I came up with this idea is because, yes, I've been in R&D for more than 10 years, but also is because when you look at these charts, just in wash programming, since 2006, so 13 years, foundations, multi and bilateral aids like the World Bank, the African Development Bank, the Asian Development Bank, they have invested I think $30 billion in WASH programming, which is great. But then you see that almost $1 billion has been invested in research and development, and only 60 million in product development. So you have now a pipeline of solutions, of technologies that no one wants because you didn't prepare basically the customers. And this is where actually it's very important as a company like Simbuka, is to first of all identify the right solutions, but also to identify who's going to be the early adopters, who's going to be the manufacturing partners, who are going to be the distribution channels. And then if you can bring everyone together as soon as possible, then you increase your chances of success because everyone is on the same page at the beginning. And I will leave you with that, and thank you for your attention. So now, if you have any questions, I'm happy to answer them.
Have you guys researched to see if the machine can also be used for tampons?
If what, sorry?
If the machine can also be used for tampons, or is it just pads?
Oh no, yes, it can definitely be used for tampons. It's just fabric, so and a little bit of plastic, so yes, there will be no problem for that. We are even considering using the incinerator for diapers.
Oh.
I have 3 questions.
Please go ahead.
They're sort of in different directions, but the first one that I may have just missed was what is other than the ick factor of coming across used pads, what is the public health argument or other larger interest argument as to why this is a need? Would you like all 3, or do you want to take a?
Give me the 3.
The other question was, who is actually eventually paying for this, that there's a profit in the end? Is the idea that a woman would put a coin in the machine to operate it and that generates the profit, or how would an investor actually recoup what they invest? And the third question, hold on, I was writing them down so I wouldn't forget them. A question about the model of having the incinerator triggered by a certain number of products put in it. I would be concerned if I was a woman in a culture where this is a highly stigmatized thing. What if I'm the one who puts in the 200th product and suddenly it triggers the whole thing and then everyone knows when I come out, I set off the incinerator? Like, how visible is that process for that model?
Yes, so the third question was, okay, the number of pads and the way it's triggered depending on the culture. The second question was about
how you actually recoup a profit from
return
this
on
investment.
investment, and the first one?
The public health or other larger argument as to why this is a need, because right now, many people are getting their need met by just chucking their products wherever someone's not looking.
Yeah, so, okay, so for the last question, yes, for me, this is actually very simple. So then again, it depends on the use case. It depends on where you are, in what country you are. So this is something that we can easily change in the design of the incinerator. If we want to have a delay between the last moment someone places a pad, and the moment it starts, it's just changing the coding. So it's very simple actually to address, and it will depend on the user feedback that we will have depending on the country where we will be. And it's only if we have the incinerator inside of, let's say, bathroom, but if we have it outside where we have an operator, then that would not be a problem. And again, this is a problem actually that we can, I would say, easily fix because it's just a question of coding. And then the second question about the return on investment. For now, actually, we have identified early adopters as the governments and some NGOs. You have some programmings from the World Bank or the UNICEF. They are willing to pay, let's say, a large number of technology and then just to deploy them. So for you as an investor, this is how you would get a first return on investment if you had to license your technology. Now, ultimately, then again, we have to develop a new business model that comes along, a service model, and then it depends on the country again, how much people are willing to pay for that. But to reach this point, I believe that you need first to educate people about using the incinerator. If they don't see any interest in using the incinerator, then there is no way actually you will ever get money about that, in doing this. So that's why actually part of this intervention is not only bringing the technology to people, but also educating people around that. So it becomes something, a need. It's like in some areas where you don't have, let's say, plastic bags. Plastic bags are not allowed. At the beginning, people were complaining. But then when you realize that, okay, not using a plastic bag is actually something that has a benefit for myself, then you stop using plastic bags. But it takes some time actually to change people's mentality. Now, for the public health entities, they see that, so they understand, so from my discussions with some governments, they understand that there is a need for that. But when I want basically to negotiate with public authorities, I will not go to talk with people in public health. I will first discuss with people from the environmental government, or ministry, sorry, because they are the ones actually who are facing the problem of menstrual waste. Now, unfortunately, the problem with menstrual health and hygiene is that it takes time basically to impact your health. It's not like actually you see some waste and then it's something direct. So this is, I don't know actually if it answers your question.
So basically, it was sort of which direction you would go to say that this is a problem. I understand it from the environmental health perspective of there's products that are not going to biodegrade, and so they're building up just like plastic bags. It's a good comparison. I wasn't sure also if you might be approaching economic interests of the amount of workforce or education force days lost by women not being able to contribute productively, or
that's also another approach. And then again, if you don't have access to such incinerator or self-disposal unit, then you end up reusing your menstrual products, which is a direct problem actually to your health. I think if I had to speak with people from public health, this is what I would say at first. Yes?
In your pilot, what did the girls or the women think about it in India, where you piloted the technology to analyze how well it functioned? What did you get any interaction about how they felt about the technology? Did they like it, like using it? Or any kind of did you learn anything about the user experience?
Oh yes, so we just started working with this technology in India, so we are still actually collecting more user feedback. But I want to say that from what I've seen in other countries, people, users are feeling positive about that. Mm-hmm. But the thing is, you need to very convince them that, first of all, it's pathogen-free at the end of the process. Mm-hmm. And you need to let them know that for some reason there will not be any direct impact on them in terms of emissions, for instance, mm-hmm. which is actually the most important thing, because people are using incinerators in India. People are burning, and then they don't necessarily understand why burning and incinerating is different. Mm-hmm. So there is a technical component that you need actually to work around, so they understand that incinerating is much better for their own health.
Okay, so I too have 3 questions. So, the first, it kind of relates to what he was just asking about how the ladies felt. And so I wanted to know if there was any thought about how the ladies would actually get it to the incinerator, because I know here, full disclosure, I used to, before I got here, I had to clean bathrooms. And I noticed that some women, and I even hear the conversation, I'm not touching this pad after it's been in me, so I throw it on the floor, they throw it in the trash can. So what was that conversation to say, oh, the lady would then take this used pad and then take it to the incinerator? And then my second question, I wanted to know, like, what was the cost difference between the incinerator that they already use compared to this incinerator? And then lastly, for rural areas, a lot of times they don't have the resources as in a larger city. So how would the incinerator be fueled or operate?
What do you mean by resources?
So like, I know here in certain areas of North Carolina, there's no formal electricity. So they'll use like maybe hydroelectric power, or some don't use it all. They continue to use candles and things of that nature. So for places like that, who don't use modern day electricity, like how would the incinerator be ran or set up?
Okay, good questions actually. All the questions were very interesting. So regarding the way we power the system, so as I mentioned before, the electrical requirement is around 30 watt-hours, which is basically the same as a radio clock. So you can imagine that your system also will be powered with a battery, simple batteries. That's as simple as that. Now, that's just for the electrical component. Now, we need to have a co-fire with gas in our design, and the reason why we chose to power the system or to co-fire with gas is because in India it's very affordable and accessible. Now, we were also discussing with some NGOs in Nigeria. Even though Nigeria they are producing oil and gas, but in some areas to supply gas is very difficult because you have terrorism. So if we want to have this incinerator in this area, in these particular areas, then we will have to adapt the system to be powered by something else. It can be wood chips, for instance, where it's more accessible. Now, for your question regarding how basically to convince women to take the pads and then place them in the incinerator. So we know it's a very big challenge. And when we were doing actually our first data collection at this cotton mill, so the women actually are just placing the pads in normal dustbins, and then there is an operator that comes and then collects all of them. So we know we have some work to do actually to better understand how to convince people, but we don't necessarily want to convince people because we don't want to change people's behavior. So I think depending on the country, we will say, okay, this use case or the only user case that we have is to have an operator that will collect all the pads, and then we will dispose of them in the incinerator that is not in the bathroom directly. And then remind me, the second question was about?
It was, what is the cost difference between the incinerators that people already use compared to this incinerator?
Okay, so if you look at these slides, yeah, so we started actually to compare our technology from a technical standpoint, but also from a price standpoint. And if you look at here, yes, the capex for me image. So our technology basically is in the right range, I would say, but it's still actually expensive compared to the local income. We are right now at $1,200, and we want to bring it down to less than $400. So the thing is, most of these incinerators that are relatively cheap are not necessarily performing well in terms of emissions. So now you as the customer, you need to decide, okay, what is more important for you? Is it your money or your health? If it is your money, then yes, you will go for that. If it is your health, then you will buy something that is more expensive, but that is safer. But then again, if you are in a country where there is no enforcement, let's say the government doesn't really care about CO emissions or, PM emissions, then you will face people actually coming to buy the cheapest thing possible. So this is also something that we are trying to address. Yes?
What are your thoughts on menstrual cups and the feasibility of sanitary implementation?
So when you say implementation, you mean providing them to young girls and women or disposing of them?
Providing them.
Providing them, I think there is a large debate in the community about, okay, do we want menstrual cups or do we want menstrual pads? Again, it depends on the country. Some people actually refuse menstrual cups because there is the concept of inserting something in your body. And some in India, we know that very hardly accepted. In some region in Western Africa, same, for some cultural reasons. So we as technology providers, we are not here basically to decide what women have to use, but more providing them actually a solution to dispose of the menstrual products. But there is a debate, and I'm not saying that in, let's say, 10 or 15 years, everyone will be using menstrual pads or menstrual cups. I think it will always be a mixed use. Yes?
I see in the picture it contains like a gas tanks, right?
Mm-hmm.
So it is quite explosive things and very dangerous, especially when you're going to deploy them in the school dormitories. So if just one of them explodes, it will cause catastrophic outcome, right?
Yes.
So I was wondering if there's better options than gas.
Gas, everywhere here you have gas lines, right? Even your car, with Tesla, your hybrid car is explosive. Your mobile is explosive. Your computer is explosive. Everything around us is explosive. It's just the way, you need to be careful about that. That's for sure. You don't want actually the user to have a direct access to the gas tank. But using gas tanks like this, actually, it's something commonly done in developing countries for cooking, for heating. And the reason why we want to have such co-fire is, from a technical standpoint, it makes sense. So you could use, all these incinerators, most of these incinerators are electrical. But the problem with an electrical incinerator is that you basically charge a grid, so you increase the temperature, and then the temperature will just melt or burn the pads. And then that's it. So basically you don't control your emissions. You are just, openly burning at a certain temperature. When you have a co-fire, well, let's say you have your pads that are smoldering, so you have some emissions, but because we have a ring with gas, then all these emissions will be in a way filtered because they will be burned for the second time, and then you will have less particulates. So that's why actually we came up with having a gas. I don't think it's more dangerous or more or less safe than other fuel sources.
If it's okay, I'd actually like to claim the last question because it is 1 o'clock.
Okay, last one.
Okay, so my question, I guess it's kind of simple, but how do you convince these countries to prioritize MH technologies, when they might have other pressing global health challenges access to clean water and things like that?
Oh yeah, so I always say we can never bring actually these technologies if you don't solve water access, if you don't solve electricity or power access. So these are the two priorities. Then once you have solved that, then you can think about that. But yeah, we know about that, and the governments that we are working with know about that. But then again, because it's not the #1 priority, it doesn't mean that you don't want to start thinking about that as soon as possible, just to educate people about that.
I'll just ask you my question afterwards. Thank you.